Directly in here. And good afternoon and welcome to Straight Talk. This is your Drive at 5 show. Catherine Tyson, your host. Good afternoon and welcome to the show. Welcome to Monday. I don't know about you, but I had sand between my toes this weekend, and that's just awesome because we live on a beautiful tropical island. And I don't know about the rest of you, but I do not get to the beach enough. So I said to myself, all right, listen, this is what you're going to start doing. All right, you're surrounded by it. It's 2 seconds away. Nothing is far, and I decided to just go to the beach. And it was like 3 o'clock. It was almost like when you get to that time where it's like, oh, forget it. And I said, nope, I'm going. And let me tell you, it was divine. It was the most wonderful experience. The water was so warm and nice, and it was so serene. And I got a chance to sit under some coconut trees, and it was beautiful. Yeah, so I'm very glad that I did that. That was, our beautiful healing waters, our salt water. My grandmother used to say, anything happened to you, go take a dip in the sea, right? And so that was really nice. So yeah, I hope you guys had a great weekend. We're back to work this week, and all I can say is if you're still working, you're blessed. So be happy, and the glass half full. Not the stuff that we can be grumbling about, the stuff that we can be thankful about. Because as you look around the world, we're so uncertain these days that what, just be happy for those people who had some tragedies happen over the weekend. My condolences to all of you who lost a couple of young people this past weekend. And listen, drivers, take time on that road. All of you to you're driving for yourself, but you're also driving for everybody else. You're driving for the person riding a bicycle, riding a motorcycle, getting on that pedestrian crossing, walking on that sidewalk, taking a jog, the little dog that's running across the street, the ball that might end up in the middle of the street, the little kid that's unsuspecting. We're driving for everybody. Be courteous, slow down, take time with your life, okay? Because it is precious, and when you're gone, you leave a void and you leave a lot of people heartbroken. So let's stay as long as we're supposed to on this earth, and then it's our time, we move on, but let's not, quicken that process. So take time on the roads right now, as well as all the time, and make sure that you're driving for everybody else around you. Yeah, and so condolences to those families for sure. We need our young people because who's gonna do it? Who's gonna take over? Who's gonna do all the stuff that we're doing? Yeah, it's very important. It is Medical Mondays on Straight Talk, and it's brought to you by Health City. So this afternoon, not unlike any other Monday, we are joined by the Health City people, and in particular this afternoon, Dr. Raghu Prasad. Okay, so people just call you Dr. Raghu.
Yeah.
All right. Good afternoon, Dr. Raghu, and welcome to Straight Talk.
Thanks, Catherine. Good afternoon to everybody, and thanks for having me on the show.
No, thank you. Thank you for coming. You are the Health City representative this afternoon, and we're talking about World Heart Day. You are a consultant, a senior consultant interventional cardiologist.
That's right.
Yeah, you sound like a pretty important guy. Right? You've been coming back and forth since 2014 to Cayman, but you moved in 2017. So you've been a part of us for quite some time.
Yeah.
Yeah.
8 years now.
Yeah. You get sun between your toes sometimes a weekend.
Yeah, I do.
And that's good for the heart too, right?
Yeah,
Dr. Raghu Prasad comes to Health City. Many years experience in the field of interventional cardiology with proficiency in procedures like primary angioplasty, complex angioplasty, including bifurc- bifurcation and CTO lesions, peripheral and structural heart disease interventions, permanent pacemaker, AICD, and CRT-D device implantations, over 10,000 plus interventional procedures, including coronary and peripheral interventions and device implants. So yes, you are the person to be talking to. World Heart Day being observed on the 29th of this month. So tell us a little bit about what you do, and then we'll get into the conversation about heart disease.
yeah. So, thanks for asking me this question. World Heart Day is celebrated every year on September 29 to bring about awareness of cardiovascular diseases, their prevention steps, and identification and screening of the problem, and then treatment of cardiovascular disease. Because cardiovascular diseases lead to nearly 18 million deaths per year globally.
Per year.
Yes, and
Okay.
it's a big number, and it accounts for almost 30% of the global deaths. And as a cardiologist, I'm not just an interventional cardiologist. It's my duty also to see that I advise my patients about the preventive aspects. So, though I love interventions, but prevention is the foundation
Right.
of you know, treating or not you going to the stage of interventions.
Right.
So, the talk today is basically focused on making the audience aware about the preventive steps, how to prevent cardiovascular disease, particularly in this COVID era, because COVID has been really heartbreaking
Right.
for the entire world, and it has its own risks. Like COVID affects patients with heart disease more than those who don't have heart disease.
Right.
And patients who develop COVID along with heart disease don't do that well. The
Right.
prognosis, the disease severity, everything gets worse.
Okay.
So that's why it is more important. And the theme of this year's World Heart Day is use heart to connect. So we're going to focus more on the digital health and the teleconsults, the telemedicine part, to make people aware of these cardiovascular problems in the community.
Right.
And it's important that because people are scared to go to the hospitals in this era of COVID pandemic, so you need to deliver healthcare instructions and preventive steps, identification of disease, and then bring them to the hospital for timely treatment. So this is the theme.
Right. Okay. So now, would you say then that heart disease or cardiovascular disease is what we're calling it, which is heart disease, yeah? Uh, would you say that that is one of the leading causes of death in this COVID pandemic?
Yes,
Okay.
it is because COVID virus infections, it has been observed to lead to increased clot formation in the blood vessels, not only of
Right.
the heart but in the brain and other parts of the body. That's called thrombosis, thrombotic phenomenon. And yeah, of course, as I alluded to earlier, cardiovascular disease is the number one killer among the diseases in the world.
Okay.
So
Period.
this,
Period.
yes,
Outside of
yes,
COVID, it was
yes,
always the number one.
always the number one. And
Okay.
with COVID, things have gone from bad to worse.
Course. Okay. Okay. And so, obviously, as a cardiologist yourself, that's very concerning, I can imagine.
Yep.
Yes. I like the fact that you said you really like prevention.
Yeah.
Because I think a lot of people miss that, right? Sometimes that, as a doctor, you think, oh, as long as people are sick, I have a job. The thing is, you're going to have a job anyway, but to prevent certain things, is the best, right?
Yes.
Yeah.
Prevention is the best form of intervention.
Yeah. My
That's
grandmother
right.
used to say prevention is better than cure.
That's right.
Yes. So, and that is true. All right. So let's talk a little bit about CVD. That's cardiovascular disease. Some of the things, what are some of the things that that you do in terms of prevention? What are some of the things that you talk to your patients about or you encourage in terms of prevention?
Yeah, we always encourage our patients to shape up their lifestyles in such a way that it leads to a heart healthy lifestyle.
Right,
That's a specific terminology that we use. By heart healthy lifestyle, I mean taking care of dietary measures, physical activity, quitting smoking, and screening and trying to identify early onset of risk factors that
right,
can lead to heart disease. That is
right,
known as primordial risk prevention. And there are many other social and behavioral aspects because everyone in this world is now stressed out for
right,
some or the other reason.
right,
So we identifying these psychosocial stressors in persons that can lead to heart problems in future.
right.
So I by prevention I mean addressing all these issues.
All right. So, for example, then let's talk about, for example, in, let's talk about your diet. Then, what are some of the things that you would say uh, to live a heart healthy life? And what are some of the things you'd say about the diet?
So in general, the diet should consist mainly of vegetables, fruits, grains, nuts, and avoiding trans fats, avoiding refined carbohydrates, sugars, avoiding sweetened beverages, and avoiding saturated fats. Basically, and reducing processed meats. This is general advice.
Right.
But if you can identify certain risk factors in specific patient populations, then you need to advise more. Like if you come across a hypertensive patient, that is a patient who has high blood pressure problem,
Right.
so you need to give them more specific advice with regards to salt intake,
Right.
potassium intake. The patient with heart failure would need some specific instruction. The patient who has heart attacks, that's called myocardial infarction, would need more specific advice on their diet. So it's like that. So basically, what I said is avoid processed food, minimize the quantity of meat and saturated fats, minimize sweetened beverages and refined carbohydrates, eat more grains, more proteins. You know,
Right.
that should be the routine healthy diet regime.
Right. So
One should follow.
fruit, vegetables,
Yeah.
your grains, your
Yeah.
nuts, and what would you suggest they drink then? Because I know a lot of people are drinking a lot of sugary things. So
Yeah.
what would you replace them with? Just water? What else?
Water is definitely good.
Yeah.
Yeah, maintaining adequate hydration is one of the important aspects. Other than that, I don't know about people who consume a lot of sugary drinks and energy drinks, but according to me, soups, vegetable soups, or fruit juices without adding extra sugars
Okay.
should be good.
Okay. So fruit juice, just natural, just a
Natural
natural
juices.
sugar.
Yeah.
Okay. All right. And what about like an active lifestyle? And what would you suggest in terms of I guess exercising?
Yeah.
Anything in particular?
Yeah, so based on one's physical activities, we can actually categorize them as sedentary, as those who are leading sedentary lifestyle, or those who are leading mild to moderate physical activity.
Right.
The guidelines issued by the American Heart Association suggest that at least you should follow 150 minutes per week of moderate intensity physical activity.
15 minutes? You said?
75 minutes of vigorous activity or 150 minutes,
Per week.
yeah, of moderate activity per
Okay.
week,
115
and
minutes.
150 minutes,
Okay. So
or
that's
75 minutes of vigorous, 150 minutes of moderate intensity.
okay.
That's the recommendation. But even something is better than nothing. Even
Right.
if you are not able to strictly adhere to these recommendations, any amount of physical activity is better than sedentary lifestyle.
Right. Just sitting
It
around.
has, yeah, it has benefits throughout the life.
Right. So you're
Sorry.
sitting in the office and you're sitting in the car,
Yep.
and then you get home and you're
Yeah,
sitting.
just watching TV, being a potato, a couch potato,
Yeah.
that's the term they use.
Right.
And then lying all the time on the bed, just not moving around.
Yeah.
So that's considered as sedentary activity. The number
Right.
of MEX, that is the metabolic equivalents that one spends,
Right.
yeah, is used as a measure
Right.
of your physical activity assessment.
Right.
Yeah, so if it's like less than 2, it amounts to sedentary activity.
Right.
So basically, what I advise to my patients is whenever you have time, find a safer place to walk.
Right.
Walk as much as you can. For those patients who develop symptoms of shortness of breath or who are unable to do more physical exercise because of their age or some medical conditions, they should do symptom limited activities. They should
Okay.
stop once they feel that they're feeling well.
Right.
Uh, that's one advice I do because it's not always possible to adhere to the standard, recommended guidelines.
Right. Okay.
Yeah.
All right.
It's not necessary that everybody should be gymming all the time.
Right.
Everybody plays active sports.
Right.
At least some, amount of walking or jogging. Yeah, that should be good.
Right. Yeah. So you just keep active somehow.
Yeah,
I always
swimming
say
is the
that.
best exercise.
Yeah.
Yeah.
Okay.
Sports, any sports is good if they are able to offer
Right.
time and
Yeah.
to go and play.
Yeah. I say that also, a lot of times because I have a Wellness Wednesday, so I talk about, you have a lot, and I talk about, if you work, when you're at work, if you can walk to get lunch, that would be good as well, not just
Yeah.
drive, because generally when you work, there's some place close that you can go and pick up something to eat.
Yeah.
And then you get a chance to get the vitamin D, you're in the sun, the activity, right?
That's a very
Something,
good
it's
point.
simple,
Even
but it's true.
the
Good.
cumulative amount of exercise that you eventually end up doing
Right.
per day by doing these little bit of exercises, moving around to get some stuff,
Right.
not leading a remote control the lifestyle.
Right.
Like you stay on the couch and use the remote control all the time.
Right.
So it's better to avoid such a lifestyle.
Yeah.
And,
Good.
keep moving around. That's
All right.
important.
Good. Yeah. So move it or lose it. Yeah.
Yes. Lose weight.
Yeah.
Lose weight.
Yeah. Definitely. I
That's
mean,
important.
everybody has that.
We
as
will
a-
talk about sedentary lifestyle, obesity, and cardiac risk factors in due course.
Okay. All
But
right.
before we go ahead with further discussions on preventive aspects of cardiovascular disease and the interventions that are available in Health City,
Yeah.
why don't you just give us a heads up about the programs and
No, I will. I will for sure. But I want to ask for the. So we talked about the eating. We talked about the exercise, and also with stress. In terms of like lowering your stress. What would you suggest for that as well?
yeah, avoid over expectations. Over
Okay.
expectations is undue reason
Yeah.
for developing stress.
Okay.
And then second thing is practice active yoga, which
Okay.
can both relax, your mental status
Mental,
and also
right.
provide you physical activity.
Right.
Yeah, meditation.
Right. So just
So
calm down.
just calm down
Go
and
calm. Yeah.
yeah,
Yeah.
anger management.
Okay.
Yeah, then nowadays everybody is chasing something or the other in their lives.
Right.
Yeah, so that has to be.
Yeah. Take it with a grain of salt, as they say. There was a saying also, there's a book, don't sweat the small stuff, and it's all small stuff, right? So it's kind of just put it in perspective that, just
Yeah.
disappointments are going to come, just, kind of be prepared for it and keep moving,
Yeah,
right?
we are all swinging between this kind of lifestyle. Nobody has an idealistic life,
Right.
to be honest, and we are swinging between inflated expectations and disappointments and despair and disillusionment in life.
Right.
So I really don't know how to balance these things, but everybody has to go through these
Right.
phases of life.
Right.
But one should try as much as possible to maintain calm, as you said,
Right.
cool down, then figure out how things can be tackled.
Right.
Yeah.
Yeah. Yeah, because if you're kind of uptight,
Yes.
then you're only kind of harming yourself. You're harming what's going on
That
in your body.
adrenaline rush.
Yeah.
That's actually the thing which causes all issues,
Yeah.
health issues particularly.
Yeah. It's funny, because sometimes even when I get upset about something, I'm really upset. I'll feel it in my body, and I'll think to myself, all right, just calm down, because you're affecting what's going on in your body, and it wouldn't make sense if you did that to yourself.
Yeah.
So let's just breathe, and it's gonna be fine. In an hour, in a day, it's not gonna matter. So let's calm down.
Yeah. So
Just kind of bring
when we
myself
talk about
to
health, it includes both physical and mental.
mental. Yeah.
That one should also, accept and know about these things.
Absolutely.
Yes.
Yeah, and bring your senses to the rescue. All right, so as you were mentioning, let's talk about this. Health City is offering a cardiovascular risk assessment package for appointments booked for Thursday, September 30th. So this is for the listeners. This is an announcement for you and anyone that you know. I'll announce it again before the end of the show. On a first come, first served basis, persons may express their interest in these limited spots by email info@healthcity.ky that's info@healthcity.ky in order to be eligible. The price of this World Heart Day special is $299 US, which is, I mean, almost like less than half of what it normally is, which is great, and it's US. So US $299. It is a cardiovascular risk assessment package. The assessment package includes vitals, blood work, that's a lipid profile, HbA1c, a discounted CT calcium score, which determines the level of plaque in your arteries, an early key indicator of risk for heart attack and stroke, and a cardiology consult to discuss the results, to assess cardiovascular risk and make a long-term prevention plan with goals and targets. So that is for Thursday, September the 30th. Uh, Email info@healthcity.ky, and the price is $299 US, and it's a cardiovascular risk assessment package. Now, I think this is a really great just thing to do, period, right? Because if you want to know what's happening with your heart,
Yeah.
why not find out? And I personally, in 2020, there were quite a few people. I would just imagine, personally for myself, about four people that were in the age range of 45 to 55 that died. And they were otherwise, to me and everybody else, healthy.
Yeah.
We saw them, they were healthy, they were on Facebook the night before, and then the next day I heard they had died. And this was like about four people. And I think that was just, it was so tragic. And so I think a couple of them I heard had something to do with the heart. And I think that, yeah, this is an opportunity for people to really screen themselves to see where you are. And then you're able to at least make some changes.
Right.
So right now, if you're eating like a burger every day, as delicious as they look and taste, they're not that delicious for the heart.
Yes.
So it might be that you want to scale back to maybe a burger a month or something. You know what I mean?
A few
At
moments on
least.
the lips, forever on the
Oh
lips.
goodness,
That's the same.
yeah. The hips aren't even the biggest problem. The
Yes.
problem is the heart because I gave up red meat totally, and I was speaking to another doctor at Health because I had done the comprehensive executive health check, and found out about the cholesterol a little high, and so I said no, it's not worth it. But I still want to know, can I have a burger a month? Like, can I at least have a burger a
Oh
month?
yeah, why not?
Come on, please.
Anything in limit should be okay.
Right, but just to find out your status, your cardiovascular status, to find out what's happening with your heart, because it's this thing that's in your body and
Yeah.
it's pumping and it keeps you going, but knowing what's happening with it is so important, especially during the time that we're in. So let's talk a little bit about some risk factors.
Yeah. So I would like to begin discussing about the risk factors by saying that cardiovascular disease not only includes only heart attacks, but it also includes conditions associated with heart like heart failure, atrial fibrillation. So the risk factors that are associated with cardiovascular diseases.
Okay,
Yeah.
so before you start with that, then can we differentiate what the difference is with heart failure versus a heart attack?
Yeah, heart attack occurs when there is sudden blockage in one of the or many of the arteries of the heart.
Okay,
Yeah, it's an abrupt closure of the blood supply to the heart, which has a very dramatic presentation.
right.
Yeah, whereas heart failure can be due to the effects of heart attack, leading to decreased pump function of the heart.
And over time.
Yeah, over time, and it can present acutely or it can manifest in the long term.
Okay.
So heart failures are usually associated with the decreased pump function of the heart, thereby limiting the patient's physical activity. It can manifest with swelling of the limbs, swelling of the body, decreased effort tolerance, easy fatigability, shortness of breath. Heart attacks usually
So,
present as acute central chest pain,
okay,
or it could be any kind of chest pressure or constriction, or it could be a severe excruciating pain, which can go to the shoulders, which can radiate to the jaw, which can
okay,
radiate to the upper back, can be associated with cold sweats, and it can lead to tremendous hemodynamic instability. By that I
okay,
mean the heart rate may go low or high, or the blood pressures may go low and lead to hypertension, leading to life-threatening situation.
okay,
So this is the thing. Atrial fibrillation is a heart rhythm disorder, which usually presents with fast, irregular palpitations. Means one can feel their own heartbeats,
right,
like pounding sensation in the chest, or fluttering of the heart, or quivering of the heart. So it's a racing of the heart. There are many ways of describing this. So one is a rhythm disorder, one is a pump function disorder, one is disease of the blood vessels of the heart. So cardiovascular diseases can also include peripheral vascular disease, like diseases of the aorta, diseases of the blood vessels of your limbs. Okay, so this is a wide array of diseases that is included in the cardiovascular diseases.
right,
So
okay,
the idea of this World Heart Day celebration, why we commemorate it, is to screen the patients, screen the persons to identify for the risk factors that can lead to these cardiovascular diseases.
okay,
So it's not necessarily heart attacks, but it
okay.
includes all that we just discussed about.
Okay, so I want to ask you, in terms of a heart attack, right? From what you just kind of described, I'm just thinking as a layman, right? Just imagine the heart is just like this, this thing, right? It's just kind of going along, boom, 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 and then all of a sudden there's this stoppage. But that's not the way it's functioning inside. It's been happening. You just didn't know, right? It's some type of buildup or blockage of some sort. Is
Yes.
that correct? Is that a good way to describe it?
That's right. That's the purpose of the whole screening program, to identify people at risk of developing heart attacks and persons who already are harboring the blockages in their heart rhythms that we
Okay,
call as lesions or stenosis in
okay,
medical terms.
right,
So usually these heart attacks happen when there is a rupture of the cholesterol plaque inside the blood vessel that occludes or stops the blood flow completely
okay,
to that part of the heart muscle. That's called the myocardium, and that's why we call it as myocardial infarction.
okay,
Yeah. So heart attacks can usually it actually present as what I said, so typical chest pain, but sometimes there are atypical manifestations and presentations.
right,
Some people just present with not feeling well. Some people present with just vomiting and gas-like symptoms.
okay,
Some persons can just have fatigue or tiredness for no reason.
right,
Some patients can have shortness of breath.
right,
So these are all heart symptoms which need to be looked into.
right. And you mentioned swelling as well.
Swelling of the legs when the heart cannot pump the blood can the fluid in the body can gravitate to the legs
Okay,
in a recumbent posture, and the patients can have shortness of breath associated with swelling of the body.
okay,
That's one of the manifestations of heart failure.
okay. I have a question also. If, uh, for instance, you have this blockage, I mean, there are different things that you can do as a cardiologist, right, to clear that. Because I know that people, when they think of a heart attack, sometimes they think, okay, you get a heart attack and you die. But that's not necessarily true.
Yes,
Right,
the golden hour concept in heart attack is that the point of medical contact from the time of symptom onset is very crucial. Yeah. So when a person experiences these symptoms, instead of wasting time at home, considering different possibilities, some
right,
people just stay home thinking that it's a gas problem and just
right.
drink some, fluid or some
To
medications at
break the gas.
home. Yeah, self-medication is really dangerous in this situation.
Right, okay.
So they
So don't
should
play
seek
around with
urgent,
that.
yeah, they should seek urgent medical attention. And earlier you open the blockage and revascularize the vessel, restore the blood flow to the heart, the better it is. The
Okay,
complications, including mortality and morbidity,
okay,
will come down significantly once you revascularize it in the golden hour, the
okay.
first hour after the symptom onset.
All
And
right,
there is something called window period beyond which, even if you intervene, it may or may not benefit the heart,
okay, okay.
because there is something called survival time. If you don't treat the heart condition in say 6 hours, And even if you do something later, it may not be that beneficial. So earlier, the you treat, the better it is.
Right.
Yeah.
Okay. We're going to come back and
Yeah.
talk some more. You are listening to Dr. Raghu Prasad. He's a senior consultant, interventional cardiologist over at Health City. Today is Medical Mondays on your Straight Talk Drive at 5 show, and it is brought to you by Health City. I'm Catherine Tyson, your host. Welcome to Monday, and welcome to the show. We're going to be back with Jessica. We're going to be back right after this message with some more. We're talking about World Heart Day. And this is on September 29th. Health City has a great screening assessment package that you could, you know, get involved with that is half the price. So we will be back with more just after these messages. Stay tuned.
3370. More straight talk to come on Star 927. You can now register to receive a securely verified services.
And welcome back to Straight Talk. This is your Drive at 5 show. Catherine Tyson, your host. Thank you so much for joining me this afternoon. It is Medical Mondays, and it's brought to you by Health City. I am in the studio with Dr. Raghu Prasad. He is the senior consultant and interventional cardiologist over at Health City, and has joined us this afternoon to talk about CVD, which is the cardiovascular disease. And it is World Heart Health Day, a World Heart Day, and that's on September 29th. And just talking all things heart. Thank you so much once again for joining me this afternoon, Dr. Ledley. All right, so let's continue talking about this cardiovascular disease, and I wanted to talk about obviously we're talking about the screening and wanting people to really get out to Health City and get the screening done. It's going to be for Thursday, September 30th, for $299 US, and that's more than half off. And you can email info@healthcity.ky in order to be eligible. And just to find out what's going on with your heart, because I think you hear a lot of people say, "I don't want to find out. I just don't want to know. I rather just," and that's the worst thing to do,
Yeah,
right?
running away from the problems is no, solution to the problem at
Right,
all.
right,
So one should make an active attempt to find out what's going on in their lives with regards to their health.
right,
And the heart is at the heart of the matter is the heart.
right,
So
right,
that's the main thing. If heart stops, everything stops.
right,
So the idea of World Heart Day celebration is to bring about again the awareness, the preventive aspects, and the advanced technologies that are available to manage heart conditions.
Right.
So that's why every year we celebrate World Heart Day, and that's why we are doing medical mandate this today to bring about more awareness about cardiovascular diseases globally,
Right.
which are happening,
Right.
particularly in COVID, in these stressful times.
Right, because as we were saying before the break, cardiovascular disease is the world's number one killer, resulting in 18.6 million deaths a year. And this is on the World Heart Federation.org website.
That's right.
And it has many causes from smoking, diabetes, high blood pressure, obesity, to air pollution, less common causes as well. But for the 520 million people living with CVD, COVID-19 has been heartbreaking. They have been more at risk of developing severe forms of the virus, and many have been afraid to even attend routine and emergency appointments and have been isolated from friends and family,
Yes.
right? And that's pretty serious.
Yeah, that's the reason the World Heart Day theme is use heart to connect because disconnected hearts are at high risk of developing the problems.
Right,
Because, as you said, people are afraid of going to the hospitals due to COVID scare,
right, right,
and this is the reason we have to bring in telehealth
right,
to just get in touch with them to make them aware of the signs, symptoms of heart problems, and bring them to the hospital for early management of the
right.
problem.
Right. And so if we're if we're dealing with blockages or blood clots or different lung issues, that's not necessarily if that's it and you're done. No, you actually are trained to combat some of these things, right?
Yes.
Yeah.
Yeah. So you said you had an executive health check done recently.
Right.
Okay. So at Health City, we have both non-invasive and invasive methods of approaching to one's heart problems.
Right.
We have screening methods. We have, EKG, the electrocardiogram, the echocardiogram, the nuclear stress test,
Right.
the treadmill stress test.
Right.
We have cardiac MRI. So these are all some forms of non-invasive assessment for screening
Right.
of presence or absence of heart problems.
Okay.
And
Yes.
then we have a cath lab wherein we do all the interventions like coronary angiogram, peripheral angiogram, angioplasties to fix the blocks,
Right.
and devices and many other interventions.
Right.
Yeah. For paucity of time, I won't be able to enumerate
Oh,
all of
of
them,
course.
but
Yeah.
this is the general idea of a cardiac setup. And we have one of the best state-of-art patient care centers uh, in the Caribbean region.
Right.
Yeah, not only in cardiology department but in other departments also.
Right.
So everything is available under one roof.
Right.
Yeah. So I would urge listeners to take care of this opportunity and get themselves screened for the heart problems,
Right.
if any. And then we have a dietitian, we have physiotherapists, we have all the allied groups to support.
Right.
It is all about shared decision making and caring.
Right.
It is a team approach, and it has to be an approach between the clinician and the person or the patient to discuss about the presence of the risk factors, how to intervene, and how
Right.
to go about dealing with these issues.
Right. So I'll ask you then, in saying that, the executive health check that I might have had then, or that I had last year, uh, that would have been like a pre-screening.
Yeah, there are
And
specific age groups. I know where
okay,
you are going, so
how do
I
you know where I'm going?
yeah, I think you want to ask like, is it essential for everybody to do this test?
Right.
Yeah, I
No,
knew.
no, no, no,
Okay.
no, no.
Yeah.
Actually, what I was asking, which that's a good answer that you're preparing, but
Yeah.
my question really was, uh, this particular one that we're advertising here,
Yeah.
right? That we're saying, you can go ahead and get the assessment, cardiovascular risk assessment package. When I did the executive health check, then it would have been some pre-screening things, right? And
Right.
so, depending on the results of that, I might have been suggested to go deeper. Is that true?
That's right.
Okay.
That's
And those are generally pretty good indicators, right?
Yes, yes.
Okay.
So there is something called as atherosclerotic cardiovascular disease risk
Right.
factor assessment. So clinically, when you come to my clinic, I ask you certain questions
Right.
about your symptoms pertaining to the heart, your presence of risk factors in the family, about risk factors like diabetes, hypertension, cholesterol issues,
Right.
smoking, whatever things we have already discussed.
Right.
So if the risk factor assessment shows that you are in the borderline or intermediate or high risk group, then you are the candidate, particularly if you're between 40 and 70 years of age, to go ahead with all the screening methods
Right.
uh, to identify the presence or
Okay.
absence of a heart problem.
Okay. Okay.
There are special risk groups also, like somebody, family member had a sudden heart death related to the heart problem. It's called sudden cardiac death.
Right.
Somebody in the family had a heart attack at a very young age. It's
Oh.
called premature heart disease in the family.
Okay.
So these are special risk groups. Those with familial dyslipidemias, like lipid profile,
Right.
the LDL cholesterol, which is called the bad cholesterol, might be high from a very young age
Right.
because the genetics part might be playing a role there.
Right.
Or some women, particularly who develop certain kind of diseases like preeclampsia in their pregnancy.
Right.
Those
Okay. Okay.
those women who have an early menopause,
Okay.
they are at a high risk of developing. And then of course diabetics, obese patients, patients who have sleep apneas, patients who have some other medical conditions like peripheral vascular disease.
Yeah.
So they are at very high risk of having heart problems.
Okay.
Yeah.
All right. And that's great for you to point those things out because I think what happens sometimes is that we might have it in our family, right?
Yes.
And somebody suffered with a particular thing, and we're not really taking it serious enough to say, you know what, that I could possibly also be at risk for this. So let me screen it and let me ensure that I'm doing the right thing so that doesn't happen to me. And I think that because that is kind of even just in families with anything, there's a lot of things like for instance, my knees, my hips are bothering me. My mom just had a hip replacement. I'm not kidding, like seriously. So there are some things that are going to be kind of hereditary, right?
Right.
That will be in your family, wherein there's no blood, I mean, there's no diabetes, there's no high blood pressure, but yet there's maybe the arthritis or something. So I think that this is a very good point that you're making to the listeners that if there's been someone in your family or some concern that you might have about something, to go and check it out and get
Yes.
it checked early.
Yes.
Yes.
Yeah, we are talking of parents, siblings, first degree relatives having this kind of heart problems.
Right.
Yeah, and then you become a candidate for early screening.
Right.
Yeah, to look for any presence of heart disease.
So let me ask you, what are some of the things that you see? Because I usually ask the doctors this all the time, because you're from India
Yeah.
and you've worked in India, I'm sure, possibly studied in other places as well. What are some of the common things that you see here? I mentioned the burger because I know fast food is huge here, right? And so some of those things might, kind of give us certain ailments that you might not see in India per se, or other parts of the world. What are some of the things that you see? What are kind of common things that you see in Cayman?
Yeah, see, because you asked about India, ethnicity also plays an important role.
Okay.
Yeah, Asians are known to have, particularly in India, coronary artery disease is seen in younger population compared to Cayman population.
Okay.
Yeah, and that may be to do with the genetics and other, dietary habits,
Right.
and there's so
Okay.
many other factors. Early
Okay.
onset of diabetes, because diabetes is very rampant in a developing country like India.
Really?
It's called, yeah, it's
Okay.
becoming the diabetes capital of the world.
Wow.
Yeah, so
Didn't know that.
ethnicity and gender, the male sex is more prone to develop cardiovascular diseases. In
Okay.
females, it happens at a later age after menopause
Okay.
because of the protective effect of estrogen.
Okay.
Yeah. So there are certain variations in different countries. In Cayman, I think the diet and sedentary lifestyle could be
Okay.
probably the cause leading to cardiovascular diseases.
So the saturated fat,
Maybe.
trans fat,
Yes.
things,
Yeah.
and
Eating a
not
lot
moving.
of red meat and not adhering to the avoiding processed foods,
Yeah.
junk food,
Yeah,
Yeah, the even what you said, burgers,
yeah,
fried food.
yeah.
Yeah,
I mean,
and I see a lot of people consuming the sugary drinks.
right.
Yeah,
Yeah. Oh,
yeah,
yeah,
yes,
definitely.
yeah.
I really, I think it's quite interesting because a lot of times the availability of stuff here is a little difficult too because we get everything brought in. And so we really have to work very hard to ensure that we are eating a lot of fruit, a lot of vegetables, as opposed to a sugary drink, drive through somewhere, get yourself a burger and fries, and a
Yeah.
nice, large Coca-Cola.
Yeah,
It's so easy to do.
yeah.
Yeah,
And you lose count of number of drinks you have per day, these
right,
sugary drinks,
right.
and also about alcohol in excess.
Ah,
That we have not touched upon
now
yet.
be careful of that now
Yes,
because
yes,
you're touching something there
yes.
because that is quite common here,
Yeah.
especially in the younger people as well.
Okay.
Yeah, because it's something to do.
Yeah.
There's not a lot to do here, and so generally when they have something to do, it involves alcohol. If it's to have fun, it's going to involve alcohol. Now, how is alcohol connected?
Yeah, alcohol in moderation or lesser amounts, in specified amounts, is thought to change the lipid profile to a favorable profile on the heart condition. But
Right,
when alcohol is consumed in excess, the balance gets tilted, not in favor but against.
right.
Yeah, so that's the problem. So one should
Okay,
know when to say no.
okay. And it's quite. Does it kind of become sugar too after a while? Does alcohol do that
Yes,
in the body?
yes, it adds to calories.
Oh,
Yeah.
okay.
And yeah, it's very difficult to tell your patients like you just have 1 unit of drink or 2 units
Right.
because when you start drinking you
You
really
forget.
forget those
Yeah.
things, you lose control over the part.
Right, right.
Yeah, it's better to avoid.
Yeah,
Yeah,
yeah, definitely.
yeah.
That'd be better for you.
Smoking definitely no.
Yeah,
Yeah,
okay.
not only the nicotine but any form of tobacco and any form of substance abuse.
Marijuana as well.
Yes.
Okay.
Yeah, yeah.
So
Yeah.
those of you who thought that marijuana was all right, it's not.
No, any
Okay.
substance abuse can, particularly cocaine, can have detrimental effects on the heart health.
Really?
Yes,
Okay. Cocaine as well.
yes, it
Yes.
causes vasoconstriction. It causes spasm of the blood vessels,
Okay.
and thereby can cause heart attacks.
Okay.
Yeah.
Okay.
They act in
So,
many ways, more than one.
oh wow.
Yeah.
So you've heard that, okay? Those of who thought, well, no, that's not going to affect it. Sorry, it does. I'm going to ask you, when it comes to exercise, what is the connection with exercise and keeping your heart healthy? What is that exercise doing? Because I know also I talked to a dietitian after the executive health check, and they talked about a fatty liver and exercising, uh, minimizing. What is exercise doing to it? Like,
It
let's
acts
talk
in,
about that.
yeah, it acts in many ways. Exercise, particularly the aerobic exercises,
Okay.
they help prevent the oxidants and which are affecting the heart adversely.
Okay.
And exercise reduces the sympathetic tone. It has a good control on your heart rate. It burns your calories.
Right.
It again exercise. There is not one just one thing about exercise helping the heart. There are many ways.
So many things.
So many
Okay.
things, positive things happening when you are exercising.
Okay.
Yeah.
All right. And so, not just a reminder again for the cardiovascular risk assessment package for appointments booked for Thursday, September 30th. And you can send an email to info@healthcity.ky. And the price for World Heart Day is $299 US, and it includes the vitals, blood work, CT's calcium score, and also just a lot of different things, level of plaque in your arteries, and it's an early key indicator of risk for heart attack and stroke. And a cardiology consult to discuss the results. They'll be talking to you,
Yeah.
yes, and assess cardiovascular risk, and then make a long-term prevention plan with goals and targets. Now, a stroke. What is the connection with stroke and cardiovascular disease?
Yeah. Some people use the word stroke loosely to describe a heart attack, but
Okay.
in real sense, in medical terms, stroke means cerebrovascular accidents,
Okay.
the ones which affect the brain. You know, some people develop weakness of the limb, some people develop speech abnormalities, visual disturbances.
Okay.
So
So
actually,
something that
stroke
happens
is
in the
more
brain.
of a, yeah. It's just like attack wherein the blood supply to the part of the brain is blocked because
Okay.
of clogging in the vessel or some clots formed elsewhere in the heart or in the neck vessels, embolizing to the brain. That is stroke.
Okay.
And these are all vascular diseases. Atherosclerosis does not affect only the heart; it affects all the vessels in the body.
Okay.
Okay, one of the best markers of identifying atherosclerosis is either you do a Doppler scan to look for neck vessels for deposition of any cholesterol, or look for a CT coronary artery calcium score. These are the indirect ways of, and people who have stiffened arteries might have disease of the vessels. So atherosclerosis is generalized, you know, disease process.
Okay.
So any vascular system, like not only brain, not only heart, it could be in the kidneys as well. Yeah.
Okay.
So this atherosclerosis affects any part, and I mentioned to you about peripheral vascular disease, wherein aorta, the largest artery of the human body, and also the peripheral vessels can also get affected. So stroke is part of the vascular disease process. And you were asking me about the benefits of exercise. So here I would like to mention that by exercising, you're not only helping your heart, you're also helping yourself control your diabetes, control your blood pressure, control your cholesterol, you know, building up that exercise, the capacity, the endurance of the body, and the aerobic mechanisms.
Okay.
Yeah.
All right.
Yeah.
Okay. So that's always good to know. Just when you're saying do this, but how it connects to it.
Yeah.
Because if you can physically kind of
And
feel
there are many
that,
medical explanations.
right.
But yeah, just for paucity of time, it's better we just stick to this part.
Right. Right. Of course. Well, you probably wouldn't understand me
Yeah.
anyway, right?
Yeah.
Yeah. So the World Heart Day, 2021 World Heart Day is world-heart-federation.org. You can check it out. Just talking about using the heart to connect, as you've been talking about the theme this year. Use the heart to beat CBD. Some of the things that they're doing. Equity, disconnected hearts are at a greater risk of heart disease and stroke due to lack of access to prevention, treatment, and control. Yet half the world's population doesn't have access to internet connectivity. Funny that that's something that we don't experience, which we're very fortunate. So that's us being thankful and kind of living in a grateful state, which is going to help our heart too, right?
Yes.
Yes. Prevention, looking after your heart by eating a healthy diet, saying no to tobacco, getting plenty of exercise. We have all this beautiful weather outside that we need to be accessing. If you have an underlying health condition such as heart disease, heart failure, diabetes, high blood pressure, or obesity, don't let this pandemic kind of stop you from attending your regular checkups. Get out there and make sure that you're still taking care of yourself. And 520 million people globally living with CBD that have been disproportionately affected by COVID-19 the last year. Due to increased vulnerability to more severe forms of COVID, the population has been told they are vulnerable, at risk, and should shelter in place. But with this the theme this year, there's lots of ways to reach them in terms of telehealth and everything else. What are some of the things that you want to leave with our listeners today?
You gave an excellent overview of uh, the risk factors, the preventive measures, and the treatment aspects of our conditions.
Right.
And I think these are the take-home messages, whatever you just described about the screening programs, dietary advice, physical activity, quitting smoking, and identifying the persons at risk of developing heart problems in the future, the assessment of their atherosclerotic cardiovascular disease risk factors. So over and above this, I can only add that prevention is, of course, I mean, I'm trying to. It's not being the overemphasis, but I think prevention is the best way uh, to tackle this problem, to reduce the morbidity and mortality associated with cardiovascular diseases. And one more thing, what I have observed in my routine practice is some patients are reluctant to take medicines lifelong.
Right.
There are some conditions which need the patients to be on medications for lifelong, like somebody having a heart problem or stroke has to be on a blood thinner like aspirin. Somebody with severe forms of dyslipidemia has to be on statins or some alternative forms of therapy. We have some injectable forms also available now in the market. And some patients of hypertension who need to be on medications lifelong along with lifestyle measures. It's not, they all go hand in hand. It's not that if you're taking medicines, you don't need to, follow lifestyle measures. It's not like that. First is lifestyle, and second comes pharmacological treatment, and
Okay.
third comes interventions.
Okay.
So, lifestyle is the foundation. You shape up your lifestyle for good, for healthy living, and then pharmacological treatment in some situations becomes a must. So just because somebody fears the side effects of medications, they just Google up things and then they start experiencing the side effects
Right.
without actually having them.
Right.
Yeah.
Okay.
So that becomes a risk again when you
Right.
don't follow the advice of the doctor.
Right.
Yeah. So medications also are important. We should try to control things by adopting healthy lifestyle. Of course, that's the number one thing to do,
Right.
no question about it. But there are situations where lifestyle is just not enough. You just have to go on medications, and many, are reluctant in the earlier part of the treatment
Right.
for medications, and they don't want to even consider medical therapy.
Right.
So my sincere advice is where it is absolutely essential, it is important that you consult your physician, the cardiologist, the doctor, and have a thorough discussion on the side effects, the long-term, short and long-term benefits of such a medical therapy, and then you have to follow it regularly.
Right.
Yeah.
So, can I ask you about in terms of diet? A lot of questions that I just asked a question about uh, is oil a problem? Like
It's
cooking with oil, and what would you suggest
No,
about
we
that?
need
Because I think,
oil is an essential
okay,
commodity that body needs.
right,
So it all depends on what type of oil you're using.
okay,
Nowadays there are a lot of oils in the market which are healthier versions.
right,
Like some people prefer vegetable oil, some
right,
prefer olive oil, some coconut oil. So it's very difficult to say which oil is healthier than the other. But
right,
when used in right proportions, I
okay,
think it shouldn't be any problem because our body needs fats.
okay,
It's not that you can entirely do away with using oil.
right.
Yeah. So I
So,
would suggest that the best one is to one should evaluate based on the clinical needs and the availability and affordability.
yeah,
They can decide on what type of oils because this is a very common and routine question that comes
absolutely,
in our clinical discussions when we are counseling our patients,
right,
like whether eating oil is bad for heart.
right,
Yeah.
right,
Likewise, sodium, salt. Salt is essential. You
right.
cannot say that you can absolutely stop.
I,
Yeah.
So the reason I asked that is because I think, I had a discussion with someone about that in terms of, when you talk about clogged arteries,
Yes.
and so when people think of when oil kind of sits and it gets, when it gets cold, how it looks, and thinking that that's what it's doing to your arteries, that's incorrect, right? That's an
Yeah. See,
incorrect,
that's a good point actually.
yeah,
Fish oils are also available. Some people are on fish, some liver supplements or
right,
thinking that that may help them in the long run by improving the omega-3 fatty acid levels.
right,
So, in fact, there are so many supplements in the markets which are available, you know, for preventing this clogging of the arteries.
right,
Yeah, but the basic thing is, if you consume anything in limited amounts and proper proportions, portions, I
right,
think that should not be a problem.
correct.
Yeah,
What about canola oil?
I'm not sure.
Yeah.
I'm not used to it.
Yeah?
I'm not sure.
Okay, well, that's on the market for sure.
Okay.
But you're saying vegetable oil, olive oil, coconut oil, not a problem.
Yeah.
Yeah? All right. So thank you so much for clearing that up. Cardiovascular disease, if patients are susceptible to severe COVID-19, at the root of the coronavirus disease or COVID is severe acute respiratory syndrome. Yes? And it's claiming lives. And so get your heart taken care of. Get your heart health in order.
Yes.
Go and get that
Particularly in
screened.
this COVID era. Yeah.
Yeah, go and get that
The
screened.
risks and the complications have actually doubled up.
Right.
Yeah, because of this virus.
Right. So check that out. Email info@healthcity.ky. World Heart Day special for your cardiovascular risk assessment package on Thursday, September 30th is US $299, and it will help to just give you an idea of what's happening in terms of your risk factors and everything. Dr. Raghu Prasad, the senior consultant interventional cardiologist at Health. So thank you so much for joining me this afternoon.
Thank you so much.
And if you want to talk with Dr. Raghu, obviously you're there at Health City
Yeah.
and available to discuss that. If you have any type of indicators or hereditary things in your family that have anything to do with the heart, you might just want to get that checked out just to take care of yourself, right? So, words we leave today: exercise, eat well. What else? Take care of your mental health.
Avoid stress.
Avoid
Go
stress.
for regular medical checks, and don't avoid any symptoms.
Right,
And don't assume that it's just a mind
right,
problem. Yeah.
right. And don't just think everything is gas. Because we in
Yes.
the islands, we think everything is gas. Let me tell you, right? And not everything is gas. Take care of yourselves. Thank you so much for joining me this afternoon. For the listeners, this has been your Medical Monday on Straight Talk, Drive at 5, and it's brought to you by Health City. And thank Dr. Raghu Prasad for coming in this afternoon and chatting with us. I am Catherine Tyson, your host. I hope you either you're home or you're almost there, and you're going to be taking a nice little walk this afternoon, having a nice apple, some carrots, some celery, right? And calm down.
Yeah.
Yes?
An apple a day keeps the doctor away.
An apple a day, is that true?
Yeah.
Well, I
That's the
know.
essence of the advice.
Yes, absolutely. Thanks so much for joining us, Dr. Redmond. Really appreciate that. And you guys have a great evening, and I shall chat with you again tomorrow, the Tuesday. Hot Topics Tuesday. You don't want to miss that. Take care and have a great evening.
Thank you. Yeah, you did it very well. You anchored it to perfection.